My name is Anissa Mitchell. I'm with PMD Alliance. I'm so happy to see everyone joining us today for this conversation that we're having around the newest book, The Parkinson Plan, A New Pathway to Prevention and Treatment. We are so excited to have our two authors with us today, Dr. Michael Okun and Dr. Ray Dorsey. They're going to be talking today about the latest book, The Parkinson's Plan. You may know that a few years ago when they came out with their first book, Ending Parkinson Disease, we had them on. We did a whole book club with them and went through that book collectively. That's been a wonderful resource. So we're excited about this new book around actions that you can take to prevent Parkinson's and treat Parkinson's. So this is going to be a conversational style program, not any slides to my knowledge. And you are welcome to drop your questions in the chat as we go along. I'm also excited to announce that PMD Alliance is going to be giving away 20 copies of their book. So this is going to be taken randomly from the list of the live attendees today. And if you are one of the lucky 20, you will be notified. I think it is next week, and we will contact you by email and make arrangements to ship the book to you. The only requirement is that you are here on this program in its entirety, and we're slated for an hour, so hopefully you have a full hour to give us. But we're excited to be able to offer 20 copies of this book for you. And most of you know our two wonderful speakers today, but I'll just do a brief introduction. With us is Dr. Ray Dorsey. He is a neurologist, a researcher, a public health advocate working to end Parkinson's disease and addressing it at its root causes, which is environmental exposures. He is obviously the co-author of the Parkinson Plan and was an author of Ending Parkinson's Disease, which came out in 2020. He is a professor of neurology at the University of Rochester and the director of Atria Center for Brain and Environment in New York City. And then with us is now Dr. Michael Okun. He is a movement disorder specialist, neuroscientist, and author who practices at the Normal Fixel Institute of Neurological Diseases at the University of Florida, and has been both medical director and more recently medical advisor for the Parkinson Foundation. So we're excited to have both of our authors with us today. And as you probably know, the book is actually, PLAN is actually an acronym for Prevent, Learn, Amplify, and Navigate, which is offering us a roadmap. We're going to be delving into that today. So I'm going to kick off. And again, I invite you guys, ask your questions as they come. We'll go through all of your questions as much as we can in the hour that we're allotted. But I'm going to start off for both of you, or whichever one wants to answer the question of what made you decide to write this book and how is it different than the first book? What are you addressing in this book that wasn't in the first?
Michael.
Yeah, so I'll start and just say, well, first, thank you so much for having us. PMD Alliance is such an awesome organization. And I don't just say that to blow sunshine. I say it because it's true. And you all do great work and impact so many lives. So thanks for having Ray and I. You know, we had a book way back in 2012 called 10 Secrets to a Happier Life. And in the prologue, I made the unfortunate mistake at the time, and it didn't turn out to be a mistake, of using the words the Parkinson pandemic, those two words, and everybody said, oh, you're an alarmist, this is crazy, we should never, you know, use those words. And the worry was that Parkinson was growing out of control. Fast forward, Ray Dorsey, myself, Todd Shearer, and Boston Bloom wrote a book called Ending Parkinson Disease, came out in 2020. Ray, our wizard of data, looked at the global burden of disease study data, calculated that by the year 2035, we would have 12 million cases of Parkinson disease. And people said, whoa. And they said, wait a minute, this is growing fast. In fact, the fastest growing neurodegenerative disorder. Now, 5 years later, 2025, here we are with Parkinson Plan. And they're saying, guess what? We're already at 11.8 million. We are growing faster than Alzheimer's disease. So if you want to know why we wrote the book, we wrote the book because we've got to get a hold of this. We shouldn't be leaving Parkinson's disease for somebody else. This is going to bankrupt healthcare systems. It's going to create suffering. It's needless suffering. We need to begin prevention, and we're not investing enough in prevention. And so the plan is P is prevent, L is to learn why, A is the amplification of voices and care, and N is the navigation to new therapies.
Awesome. And did you have anything additional that you wanted to add to that, Dr. Dorsey?
Yes, you got to call me Ray.
Okay, Ray.
Kudos to the PMD Alliance. It's organizations like you that are going to change the course of the disease. And the book, we highlight the rise, and we highlight why that's rising. We also give you a plan for society, and we give you 25 actions, the Parkinson's 25 actions that you can take in your everyday life to possibly slow the rate of progression of the disease. 25 actions you can do to slow the rate of progression of the disease, and 25 actions your friends and family members, your children can take to reduce their risk of ever getting the disease.
Well, let's dive into the prevent part. So how do we prevent this from happening? And I know we hear a lot about genetics. We hear a lot about environment. Can you talk about that? Like what is actually, break down what is happening, or what is more important, the genetics or the environment, and what's going on?
So we can now answer that question. We can now answer that question definitively. And thanks to the Parkinson's Foundation, and likely some people participating in this call who participated in a study called the PD Generation Study. And that study offered people like you with Parkinson's disease free genetic counseling and free genetic testing. Over 10,000 individuals have participated in that study. And they looked at the results for the first 8,000 individuals, largely from the United States. And they found that 12.5% of Americans with Parkinson's disease carry a genetic cause or genetic risk factor for the disease. Said another way, 87% of people, the vast majority of Americans with the disease, have no known genetic cause or risk factor for the disease. 87% of Americans have no known genetic cause or risk factor for the disease. The answer lies not within us, but outside of us in our environment. Chemicals in our food, especially certain pesticides, in our water, especially certain dry cleaning chemicals, and in our air are fueling the rise of this largely man-made disease.
So can you talk about the food? Let's talk a little bit about food, because obviously, there's some things that we don't have control over as far as what we're ingesting and what's exposed. How do we know what is the high risk things? What do we have control over for as far as what we buy at the grocery store?
So I'm going to show you here exactly what you can do in your everyday life. And this is from the book. Oh my goodness, maybe if I can open it up. So can I share my screen?
Yes, please.
Perfect. So you can see my screen?
Yes.
Yes.
And so this is the Parkinson's 25. It doesn't look quite as good because the book's not in color. I'm sorry. And shout out to our colleague Monica for making this. And we give you 25 actions to lower your risk of Parkinson's. For those with the disease, some may even slow progression. Most apply to all of us, regardless of age, sex, disability, or geography. And so number one is to wash your produce. So this is what you should do if you have Parkinson's disease. Wash your produce, even your organic ones. Pesticides have contaminated our food supply. Remnants of pesticides are found in 20% of common foods. Organic produce, dairy products, and meat can reduce exposure, but can still have unsafe residues of pesticides. So wash your produce at least with water, and consider simple vegetable washes, vinegar, or salt solutions too. And we give you for each one, the chapter 1 is on food, chapter 2 is on water, chapter 3 on indoor air, and chapter 4 is on outdoor air. And the Parkinson's 25 is organized along the same way. So these first recommendations are all about food, things you can do in your everyday life. These are relatively inexpensive. They're accessible to almost all of us to decrease your exposure to toxins in our food.
So let's talk a little bit about, because I know that most of the people on this program today have Parkinson's already, but they may have loved ones that they're concerned about. There may have other people that obviously might be joining because they're interested or watching this on YouTube because it is being recorded. So I do want to cover just a little bit about the exposure. So we get the food, and you talked about washing it, and I did have a question around, like, is it as important to buy organic if you can't afford it? Is there like certain ones that you would, like a Dirty Dozen? I know we still need to wash them, but are there some produce that are just higher risk that we should always consider buying organic?
Yeah, so I'll back up. So we know some people with Parkinson's have rapid rates of progression and some have slow rates of progression. And we argue in the book that perhaps one reason why some people have a slower rate of progression is that they're not getting exposed to these toxicants. If a smoker is diagnosed with lung cancer, what's the doctor going to tell them to do? Stop smoking. If a farmer is diagnosed with Parkinson's, are we telling them to stop getting exposed to certain pesticides or reduce their pesticide exposure? So these recommendations certainly apply to your children, your grandchildren, but they really apply to you. That we know, for example, that ongoing air pollution is associated with an increased risk of hospitalization due to Parkinson's disease. So we put these 25 things in there to maximize your chance of slowing your rate of progression. Now, cost. I'll tell you what's expensive. What's expensive is Parkinson's disease. Parkinson's disease costs society $50,000 per person. It costs everyone on this call $25,000 in terms of disability, lost income, and caregiver support. So we need to stop subsidizing conventional pesticide-laden produce and start supporting organic farmers, communities, and organic produce. That's much less expensive. We spend over $15 billion as a society on agricultural subsidies. 99% goes to conventional farming. The two crops that are subsidized the most in the United States are corn and soybeans. The two crops that are sprayed with the most paraquat, pesticide most strongly linked to Parkinson's disease, are corn and soybeans. We're taking billions of your taxpayer dollars subsidizing the production of subsidizing the use of paraquat on fields on corn and soybean fields. That needs to stop. That's part of our plan. Now, if you can't afford organic produce, the environmental working group highlights like the Dirty Dozen, as you were alluding to, foods that are especially prone to pesticide contamination, and they hire, I think, the Clean 15, things that are less likely to be contaminated, and that's a great resource for doing so. But we got this, we need to like make our voices heard. It's kind of backwards that we are spending all this money to subsidize the use of pesticides, which lays the seeds for Parkinson's disease.
So you mentioned air, both outside, obviously, and then inside. So we can't necessarily control the air we breathe outside unless we move somewhere that is very, very remote and maybe has a lower risk factor. But what about inside? What can we do? What do you recommend to people in terms of helping the air quality in their home?
So I'm going to share more of the Parkinson's 25. You guys are getting a great sneak peek at everything. And, we're making this as available to people as possible. So number 10 is consider air purifiers. Air purifiers are an easy, effective way to lower your risk of disease from indoor air pollution. Purifiers do range in cost, require periodic cleaning and filter changes, and may need to be installed in multiple places depending on the size of the home, school, or workplace. Be sure to use air purifiers with carbon filters designed to remove volatile organic chemicals like trichloroethylene. I live in New York City now, and so we have an air purifier in our living room and in our bedroom. You can get a simple monitor to measure the amount of particulate matter, the little pieces of dirt and soot that are suspended in the air that you can see in smog, for example, in Los Angeles. And you need to minimize your exposure to these chemicals. These particulate matter is increasingly linked to Parkinson's disease and very strongly linked to Alzheimer's disease. So if you have Parkinson's, consider an air purifier. We also give you some very simple tasks, simple recommendations like rolling up your windows if you're in traffic. So if you're in New York City and you're driving through the Lincoln Tunnel, you want the window rolled up and you want to circulate the air in your car. So we give you lots of recommendations, very pragmatic on how to reduce your exposure to air pollution. One other thing on indoor air pollution, you want to see if you live near, well, a golf course, as you probably saw, living within a mile of a golf course associated with 126% increased risk of Parkinson's disease. You want to make sure if you're living near a farm or where pesticides are sprayed, simply living or working near where paraquat is sprayed is associated with a doubling of the risk of Parkinson's disease. And then if you live near heavily trafficked areas, highways, freeways, you want to be especially mindful of minimizing exposure.
And in terms of in the household, are there cleaning products that are also increasing exposure, and what can we do alternatively? What kind of recommendation? I'm sorry, I keep making you share this.
That's all right. That's all right.
We like this.
Okay.
Where did it go? Number 11, one of my favorites, don't poison yourself. Sometimes the remedy is worse than the disease. Insects, including fleas, ants, and moths, can be unwanted guests. Unfortunately, some common pesticides can increase the risk of Parkinson's. For example, the pesticide permethrin found in flea collars and sprays, mothballs, and outdoor apparel can reduce dopamine-producing nerve cells in lab animals. Consider safer alternatives and, if necessary, minimize exposure by wearing a mask, increasing ventilation, and avoid spraying near children. And so these 25 recommendations are all like a very short synopsis. There's a whole chapter on the Parkinson's 25, chapter 6, following Michael's great discussion of why we need to learn why the disease begins. And all this follows 4 chapters on what are the likely chemicals that are fueling the rise of Parkinson's disease.
Before we transition to the learn part of that acronym, there's been a couple of questions that come in. One, DDT has a long half-life. Is it still a known presence in our soil?
Ooh. Well, so DDT is still a known poison in our blood. So those of you who are young enough, 50s or older, likely have metabolites of DDT in your bodies. I don't know if it's still in the soil. I don't know, but how about when Michael's talking, I'll get you an answer.
Awesome,
So I
thank you.
think what I've read is that, and from what's available from public records, and Ray, you can maybe verify this by taking a quick look, is that it actually, where it is contaminated and it isn't cleaned up, that it is still there, potentially in the environment. So it doesn't go away. So I think that we still have DDT out there, and it's something we have to be, cautious of. Now, of course, as farms circle crops and change things in soil, and depending on which type of farm, that you're operating, that may change. But we still do have some DDT in our environment.
And it does, and it still is, according to the EPA, because of its long persistence, long half-life, it's still found in soil. One of the little thing on some of these pesticides, they're fat-loving, and your brain is covered with fat. And some of these pesticides, including a cousin of DDT called heptachlor, has been found in the brains of individuals with Parkinson's disease, along with fewer dopamine-producing nerve cells in the part of the brain that's known to be affected, called the substantia nigra. Some of these pesticides, which are fat soluble, can then be found in women's breast milk and can be passed on to their children when they're breastfeeding.
We also had a question, can you get exposure to paraquat from products such as that contain corn oil or tofu, as opposed to just eating corn and soybeans?
These are all great questions. So I don't know the answer to that, but I do know the answer that shortly after the Vietnam War, where Agent Orange linked to Parkinson's disease was sprayed over fields in Vietnam as a weed killer, General Colin Powell, when he was in 1963, was spraying a very concentrated form of Agent Orange, Agent Purple over Vietnam, and he himself developed both Parkinson's disease and multiple myeloma linked to the disease. After that, the U.S. administration, Nixon administration, sprayed paraquat over marijuana fields in Mexico and even in Georgia. And people who were smoking some of those cannabis plants were actually smoking paraquat. I don't know about its residues in food. I'll look at that when Michael gets a chance to answer some questions.
They're giving you some great ones.
They're giving great
Everyone
questions.
studied up. I have this feeling that Anissa got everybody studying up for you, Ray.
Michael's
Wow.
happy to see me stumped.
I know, it's good. It's awesome.
We have a bunch of very informed folks. One question is, how can we find out who does and doesn't spray paraquat on their crops? And they also want to know, do we know if it's banned in Canada?
So in Canada, my understanding was the manufacturer voluntarily withdrew use of paraquat in 2022. Over 50 countries, including China, have banned paraquat. England has banned paraquat, but still exports it to Brazil, Mexico, and the United States. I think if a country determines that a pesticide isn't good enough for their population, they shouldn't be sending it to the United States. The other question was, what was the first part of the question?
How do we find out who does and doesn't spray their paraquat on their crops?
So the U.S. Geological Survey, I'll put the link in the chat, has a map of where paraquat is sprayed throughout the United States. Just about every state in the union is sprayed with it. And data from the U.S. Geological Survey over the last 5 years, for which they have data available, has indicated that use of paraquat is increasing. In fact, the amount sprayed over the last 5 years has doubled. And I'll put that in the chat.
That's scary.
It is scary. It's totally scary.
So the LEARN part of your acronym, I know there's a lot of people interested in part of that. Is wanting to know if you can discuss the importance of obviously people understanding their disease, how it starts, how it spreads, how it progresses. So I know that's something that you break down in your book. So I don't know, Dr. Okun, can you talk about how the disease starts and then how it spreads?
Yeah, so, in very basic terms, if we want to, ever get at, treatments that are going to be super meaningful and super impactful, and maybe one day cures for, say, particularly some of the more specific forms of Parkinson, because Parkinson isn't one disease, we've got to get to the root causes. And so one of the things we talk about a lot is how you get to the root causes. And so what we've done is we've interviewed dozens of experts from all over the world. And one of the shifts in thinking is that we have to start looking upstream. And what do I mean by that? Well, once you have all these proteins and everything bathed all over your brain and your body, remember, it's not just a disease of the brain. So we see them in your gut, we see it in your skin and in other places. It may be too late. And so when we start thinking about why and making that investment into why and spending money as to, where does it start? Why does it start? Where does it start? How does it progress? We have to really go as far upstream as possible to see the original inciting events, because we're spending a lot of our time and a lot of our money downstream. So that's one of the things that we talk about a lot in this book. The other is this idea of, how might it get into? And so we had some really nice interviews and review, a lot of the history. And there's a really fantastic researcher and clinician from Copenhagen, Per Borghammer, and he talks about body first and brain first Parkinson. And we have a really nice figure and had a really great exchange with him, and Ray's written a few papers with him along the road here. And the idea being that what if the vector comes in through the nose, okay, and that's the brain first, or through the gut, and that's the body first, and then you begin to take apart that hypothesis. Do we know that every hypothesis that we have is correct? Certainly we don't, but we need to begin to start thinking about what those original inciting things are. Ray, do you have anything to add to that?
I think this, since you're a sophisticated audience, if you think about it, what are the two earliest features of the disease? One is constipation. And so if someone's getting constipated, it begs the question, why? And that's, I think, perhaps because the disease is beginning in the gut and affecting the nerve called the vagus nerve, which is responsible for moving stools along. So that's one big clue. The other feature that happens years before the diagnosis, sometimes decades, is loss of smell, suggesting that the first place the pathology is found in some individuals with the disease is in the nose. suggesting that chemicals that we inhale could be initiating the pathology beginning in our nose. So we have two great clues as to where why Parkinson's disease might be starting, both in the nose in some individuals and some other individuals in the gut. And this could be because of chemicals that we're either inhaling, like certain pesticides, or ingesting, dry cleaning chemicals and contaminated water.
Well, I'm gonna ask you, and I think I still have to go back to some of the chemical stuff because we're still getting a lot of questions about that. But I wanted to know, in regards to the learn part, with progression and everything, is there anything that people can do to impact or modify the disease progression? Can you talk through any breakthroughs in research, not only in maybe how we can early identify the disease, but then also anything that might be leaning towards a disease modifying treatment?
Yeah, so when we think about disease modification, we're thinking about, could we do something that significantly slows the disease progression, right? Or gets rid of the disease, entirely. And so we've invested a lot of money and a lot of time into kind of needle in the haystack. A bunch of experts get together and they decide, okay, this group of compounds could be protective. And then they look at the animal data, maybe they do some more animal data, and then try to bring it forward and create a drug or create an approach that's going to get us some form of disease modification. Or a term that used to be used a lot was neuroprotection, and it fell out of favor for disease modification. The reality is that aside from exercise, there's not a lot of data that's really pointing to treatments having great disease modifying effects. There was a bit of a blip, a positive blip recently for the GLP-1 drugs, with one drug appearing in a journal called the New England Journal of Medicine from France, one of the GLP-1s, lexenatide, showing potential for early. Are we nipping the edges? I think I had spoken to a New York Times reporter when that came out. Are we nipping the edges of this, or do we need a little more data? So that study was sort of positive, but very mild. And then we got another study on an exenatide, which is a different type of GLP-1 approach, that was completely negative. And so, and so we really haven't gotten there in disease modification. And I think it begs the question as to rethinking how we're approaching this. And then, of course, doubling down on our investment in prevention, right? So what's the best treatment? Prevention, right? Altogether, at least for the next generation, and preventing all these people with the exploding numbers. So we spend about, a couple of pennies on every dollar, okay? 2-3 pennies on every dollar on prevention. It's just not enough. So we call for a proportionate increase in our spending in prevention of Parkinson's disease. And then when it comes to disease modification, you also have to remember one other thing. And that's that sometimes when we have a drug that has a positive effect, you give it to somebody and their symptoms get better, it's hard to tell whether or not it actually modified the disease. And so it's possible some of these actually might be modifying the disease, like we see, for example, in some of the multiple sclerosis drugs. And so the field has begun to move toward what are called biomarkers, or just markers of disease. So you can see where things are over time. We can begin to measure that, and we'll have a much better idea if we're actually moving the needle in these areas. And so right now it's a little hard to measure. We're getting better at that. And we just, I don't know, Ray, I'd give us a failing grade on development of neuroprotection and disease modifying. Where would you grade us?
Yeah, I agree. Listen, over the last 25 years, we've had no major therapeutic breakthroughs for Parkinson's disease, and the number of people with Parkinson's disease has probably tripled worldwide. Michael and I start out the book and show that the rise of Parkinson's disease is happening on our watch, right? And we're pretty bright Parkinson's specialists, and I think that indicates that we're failing. And so we wrote the book because we're failing to address what's plaguing all of you and what's plaguing 250 people who are being diagnosed with the condition today, what's plaguing 100 people and their families who are dying with Parkinson's disease today. And we didn't like failing, and we don't like seeing this rise happen on our watch. And when I see someone with Parkinson's, I get pissed off because I think it's preventable and unnecessary. And so we give you the Parkinson's plan to prevent this for your kids so that your generation, our generation, is the last generation to bear the burden of the disease. That's why we wrote the book, and that's why that's why we're here.
So I do want to go back because we're getting so many wonderful questions. I'm trying to get to as many as I can, but these are more related to the exposure aspect. And then I'll jump back down because we're getting questions that it's going to be related to the amplifying of the voice. But one of the questions was, and you had mentioned washing vegetables and you mentioned vinegar. So they wanted to know if the result of washing and rinsing and soaking organic produce in water plus vinegar equals the result of washing non-organic produce. I'm telling you, we have a bunch of smarties in the room. So.
Michael's like, this is beautiful. So I have not seen a randomized controlled trial comparing the two. Vinegar and salt solutions have been shown in studies to reduce pesticide residue. I don't know if it reduces to the point of organic produce. We highlight in the book, and we detail actually some of the studies with the references, that organic produce can still have unsafe levels of pesticides. So I recommend all people, I'll tell you what I do. I get a glass bowl. I buy organic if I can. I have a glass bowl. I put everything. I put my apples in there. I put water. I put a little vegetable wash because I personally worry about fat-soluble, fat-loving pesticides. And I like, just like we bathe ourselves with soap and water, I bathe my apples with soap and water. And so I wash it. You can use salt. You can use vinegar. I wash them for, a few minutes while I put away the rest of the groceries. I come by, I rinse them several times, and then I put them in my basket to be eaten. It's worth noting that the U.S. Department of Agriculture, when they determine what residues are safe on an apple, for example, they do so after that apple's been held under cold water for 15 to 20 seconds. So I don't know many of you, but I've never held a piece of fruit under cold water for 15 to 20 seconds. But that's what our federal government is doing when they measure and determine whether the residues of pesticides are safe. So I share your concerns that everyone has, and that's what I would do. Paraquat in food. So unlikely, most paraquat, when it's sprayed, it binds pretty tightly to the soil, so it shouldn't be in the food. The EPA's own website says 1 sip can kill, and it tells tragic stories in an 8-year-old child drinking paraquat that was left in a Dr. Pepper can by his older brother who had sprayed it on the fields, and he drank it and died. So it should not be in food. It's not a promise, but that's what it shouldn't be.
Good question that just came in, and I will go back to some of the earlier ones. Is food that's labeled organic really always organic?
Yeah, and so this is, it's what I'm not doing the labeling, but I can say that there have been studies that have looked at produce labeled as organic and found it to have not only residues of pesticides, but unsafe residues of pesticides. Europe, which does a great job of banning many of these harmful, most toxic pesticides, still exports these pesticides to other parts of the world. And then the produce that they import will have residues of the pesticides that they banned in their country themselves. I mean, it's madness.
See.
Yeah, and let me just add to just a dogpile on a bit here. When you look at a product and it says natural, it says organic, or it says whatever, it's up to that product to prove to you that that really is, what you're getting. So be very careful. It's so easy on nutraceuticals to throw that, those words around and people get confused. And so if if you're sourcing from an organic farm, it's an organic farm, that's a good thing, right? And but if you don't know, if you're just buying it, in the grocery store and it's organic and you're not asking questions about their supply chain, then you may not know. And we're finding that to be true. It's like turning the stone over, and it's a shame. And so it gets back to this idea that even if it is organic, you should probably still wash it.
And I'll just say Amy Lindbergh, the great Amy Lindbergh, wrote, who's featured in the book, and her story is powerful. Wrote that's a slippery, expensive slope, the labels. But I do pay a lot of attention to organic dairy products. I do pay a lot of attention to organic meat because when you eat a dairy product, you're eating what the cow ate. And in the book, we show how pesticide-laden feed to cows is concentrated in their milk and then makes its way onto milk shelves at unsafe levels. And the same thing happens with food. Animals concentrate relatively low levels sometimes in the environment of these chemicals on their feed and concentrates it in their fat, for example, and it magnifies as it makes its way up the food chain. So we talk about produce, but do pay attention to dairy products and meat. And if you feel like the regulators aren't doing enough to protect consumers, then tell your representatives that regulators aren't doing enough to protect consumers. There's a whole movement in the public that chemicals in our food, water, and air are fueling the rise of chronic diseases. And I think there's a tremendous amount of truth to that. There's a tremendous amount of truth to that, to Parkinson's disease, and we need to hold our representatives accountable to this.
I'll also say, Anissa, a lot, I'm trying to answer as many questions as I can here, and
I see that.
get
Thank you.
at the idea here. Let's not leave here without giving some practical tips and for people that have Parkinson that are on the call. So for Bill and everybody that's commented on that, we definitely don't want to leave the call without that. But also remember, when somebody is a smoker, the first thing you tell them to do is to stop smoking, even when they get lung cancer, right? So these things, Bill and others that are asking, they are still important, you know, even if you have Parkinson's. So just wanted to make sure to emphasize that.
Yeah, and I definitely want to give plenty of time for you to address those things that they can do if they've already been diagnosed, and then obviously we've sort of alluded to like what we can do to amplify the voice, not only of the people living with it, but then how they can amplify their voice to get some change. One last question related to the food, because obviously we're all eating and we want to know what we can do to minimize exposure. There was a great question about, can we detox by using products such as binders? Are they effective? Is it too late? Is there anything that you can do to detox?
Michael, you want to start with this one for a change?
No,
I'll go. Do you
I'm
want me
going
to
to bounce
go?
it back to you.
Okay. So there was one great study done in New England Journal of Medicine to look at chelating agents. So for example, people with Parkinson's disease and Alzheimer's disease have high concentrations of heavy metals in their brain, like iron, for example, and no one really knows why. I suspect that these metals are getting there, are hitchhiking on that small particulate matter that we're breathing in. Some of that particulate matter, most of it we cough out and sneeze out, but some is so small that it penetrates the nerve that's responsible for smell, which hangs in our upper nasal air passages. And hitchhiking on this particulate matter are toxic metals, lead from leaded gasoline, iron from brakes, and platinum from catalytic converters. So this study looked at a chelating agent to take iron out of the brain in people with Parkinson's disease. And indeed, the chelating agent did take iron out of the brain. But people with Parkinson's got not better, not the same, but got worse. So their progression was worse, and they are side effects of the medication. So I think you should have like several grains of salt when thinking about like chelation or other therapies to try to remove these toxins from the environment, from your bodies. One, it's hard to get them out of the brain, and two, it may be dangerous to do so. That said, it's still a reasonable thing to be thinking about. And that's why we spend a lot of time talking about preventing ongoing exposure to these chemicals. And then we should give a shout out to exercise. If there's been a major therapeutic breakthrough this century for Parkinson's, it's exercise. When Dr. William Gowers described the condition in the late 1800s, he said the life of individuals with Parkinson's should be quiet. And it should be everything the opposite. It should be like an Amy Lindbergh who can outrun and outjump and outbox me. And people should be exercising because, as our colleague Boss Bloom has showed, that this leads to changes that can be seen in imaging in the brain and likely releases growth factors which can protect the remaining nerve cells from ongoing damage and future progression.
Thank you. Lots of great questions. So I want to get to sort of that amplify aspect of your acronym. So amplifying for prevention and for treatment begins with kind of building that whole universe. What does that look like? How can we achieve it? And I love someone's question, kind of to make this long, but they said in your first book, I find the PD community being quiet. You talked about condoms put on over houses for AIDS, chaining themselves at doors. If we know that paraquat is the cause, how can we start with stopping how PD starts? We need action. Let's start at the source. So that's their comment, and that, added to my original question. How do we make a change? How do we amplify the voice of those who are worried about this?
So I'm trying to catch up to the answering questions as
Thank
Ray's
you.
talking. But I just put in the chat there to the answer to that question. Everybody sign up for PD Avengers at pdavengers.com, number one. Okay, that was the grassroots group that came together after we published Ending Parkinson. There's only about 10,000 of them. We need a lot more people. Our voices aren't loud enough. I'd give us an F in advocacy, although we're all trying hard. Sorry, it's not enough. We did better in polio. We did better in HIV. We talk about this in the last two books, and it's really important that we raise our voices. Back to Bill and some of the folks that are talking about, okay, what else can we do about amplification? Well, Bill and others, we got 12 million folks already with Parkinson's. So let's talk about what we need to do. One of the things that we need to do is we need to be thinking about our care systems in a completely different way. We do much better with cancer and with HIV. We need to learn from our other colleagues. We have said in the past, and I'm a broken record of saying the patient's the sun and the person with the disease is the sun, and we should all revolve around that person. We've gone one step further, okay, in this book. We have a care model that we propose called the Parkinson universe. It works something like this. You've got all the planets, you've got the sun. The person is still the sun. Who is Mercury? Mercury is the communicator, right? It's right next to the sun, so it gets hot, being the care partner or caregiver, right? And so that is Mercury, and we need to take care of those caregivers, okay? We know that the success of people who are caregivers and care partners is directly linearly associated with how well the person with Parkinson does, okay? So that's an important part of the care model, is taking care of the people that are taking care of the people, okay? And then we've got all the planets. The planets represent all of the many disciplines, double-digit disciplines, psychologists and rehab specialists and people that we need in the orbit to help folks to be successful, okay? Then you got Pluto. Pluto is the almost planet, right? And that represents stigma in the universe model, right? We should get rid of stigma. Why is it that 25% of folks with Parkinson have to hide their diagnosis? That's unacceptable, okay? So we need to bring the stigma down to zero, but it's always there. It's always kind of out there, orbiting, and it just kind of won't go away. Very important to get rid of that. We need technologies. And when we think about satellites, right, that are in our universe and all these new technologies of wearables going in, bringing care into the home, Bill and others, super important. We should be taking advantage of all these sensors and getting people to sleep better, getting care to people in their homes. We should be able to monitor people remotely. Ray's done some great research on this, super important. The stars, who are the stars? PMD Alliance, the stars, right? The people that are out there that you look up, and they provide those guiding lights that you need to be able to exist and to move forward. And then the last one is my favorite, not because it should be, because it's kind of a negative one, but because I like to use a Star Wars analogy in the book, and that's the asteroid field. And it's kind of like when Chewbacca and Han Solo, you've probably heard of those two characters from Star Wars, they're flying through the asteroid field, and they're asking the question, what's the odds they're gonna, with their big ship, the Millennium Falcon, make it through this and survive? And it's like 1 in 3,720 or something. There's actual odds for it, by the way, if anybody's interested. And that's about the odds of navigating through this complex universe in Parkinson. And so if we don't create a new model for care, and we don't follow our colleagues in navigation in HIV and in cancer and other areas, and help folks through, how do we expect them to be able to survive and to thrive? And so that's one of the things that we bring forward in the book. And that's part of the amplification of voices. It goes to beyond just the amplification of voices for prevention. It's the amplification of voices for the 12 million and growing faster than Alzheimer's that we have to take care of.
Absolutely. And what about those people that are living in the rural communities with limited access? I mean, it may be hard even for those in metro communities to get that universe, but any thoughts on those who are struggling in rural communities?
Yeah, Ray, you want to talk about that?
Rural communities in Parkinson's disease?
Yeah, and telemedicine and how we can get out.
Yeah, so unfortunately, we're not just doing a very good job of caring for people with Parkinson's disease. Only 9% of people with Parkinson's disease see a Parkinson's specialist like Michael and me. Only another 50% see a neurologist of any kind. 40% don't see a neurologist of any kind. Those that don't are more likely to fall, fracture their hip, be placed in a nursing facility, and to die. And people living in rural areas are among them. We spent a lot of years trying to use telemedicine as a means to provide care to anyone, anywhere, and Medicare now covers telemedicine. Thank you for all of your advocacy efforts on it. That coverage lapses in September 2025, so we need to make sure that that doesn't happen. It's really, 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 really challenging to do so. And I just don't think we've come up with the right solutions. In the book, Michael outlines a new care model for the disease that puts the patient, not the doctor, not the clinic, not the hospital, at the center of the model. And that's what we need to do. We need to center care around individuals and their caregivers and not around hospitals and clinics. We need to make care more accessible in the home and more accessible through technology on simple smartphones and the like. And yes, only 9% of people with Parkinson's see a Parkinson's specialist in the US. And that's where we spend one out of every $5 on sick care and almost nothing on trying to prevent people from ever getting this disease.
We had an interesting question. Based on most people having symptoms years to decades before being diagnosed, is young onset becoming the normal age of diagnoses?
Not yet, guys. Good question, but it's becoming more common, right? And when you look at the history of, when Parkinson in 1817 saw those folks on the street, the number of people who had Parkinson before the Industrial Revolution and after the Industrial Revolution, we're seeing a dramatic increase, right? So it may be that as you age, the aging plus your environment, so bad air, bad water, bad food, brings that, forward. But hey, look, we're seeing this so much more in young people, and there's a lot of people who are undiagnosed too. And so, has the age reversed? No. Will it reverse completely? No, I don't think so. But I think that we are seeing a huge proportionate increase in identification of younger people with Parkinson, and that should make us more concerned about the environment. And there was a study last week out of Israel that showed that even if you have a family history of Parkinson's disease, even with a family history, folks, okay, and a gene, like you're still like other family members, only 19% of people get Parkinson's. So Ray, I can tell you want to dogpile onto that. Go.
So look at the most prominent people with Parkinson's disease. Michael J. Fox, Davis Finney, Brian Grant, Sarah Whittingham, Amy Lindbergh, all these individuals with young onset Parkinson's disease, Parkinson's before the age of 50, none with a family history of the disease, to my knowledge, none with a known genetic cause or risk factor for the disease. These chemicals in our environment are setting the stage for people to develop this disease at a young age and in older life. The exposure, that relevant exposure, can happen at an early age. We talk about Brian Grant, the former NBA basketball player. He was a 3-year-old boy at Camp Lejeune when his father, a Marine, was based there, and he was likely drinking water contaminated with TCE, and develops Parkinson's disease 33 years later. The Marines who served at Camp Lejeune and service members like Amy who served at Camp Lejeune were on average age of 20 when they were exposed. They were only exposed for 2 years, 25 months on average. Yet 33 years later, they were developing Parkinson's disease at a 70% higher rate than people who served at a less contaminated base in California. The seeds of this disease are planted early. We give you the Parkinson's 25 so we can prevent your children and grandchildren from ever developing this disease. If you don't get these exposures, you are highly, highly, highly unlikely to develop this disease. And we give you these recommendations to help slow the rate of progression of the disease for those who are already affected.
Real quick, I got 2 questions that I think compare pretty well. One was, how often do people get misdiagnosed? And the other one was, how is testing for Parkinson's advancing?
So I'll say that unfortunately, it's pretty common to see a misdiagnosis of Parkinson. The other thing I will say is we need to teach folks to to not be so hasty. And what I mean by that is we need to see people have an open mind and follow them forward. Second, when we say you have Parkinson's disease, we're kind of doing it wrong across the board. People are taking that as a death sentence. And as Larry Gifford says, it should be a life sentence. There's so many things that we can do for Parkinson's. My apologies to Alzheimer's, but Parkinson's is not Alzheimer's. And so we need to help people to get off on the right foot and then get them connected with care. And so part of that is making the diagnosis correctly. Now, will we see advances with some of the biomarkers that are coming to help people to become more accurate with it? I think so. Will that alleviate, even with AI, the role of a clinician to be able to really watch people, make sure they're not morphing into different types of Parkinson's, we get the diagnosis wrong? No, it doesn't take the human element out, but it certainly could decrease the time and increase the accuracy to getting people diagnosed. My concern is when we diagnose people, that it's not diagnose and adios, it's diagnose and let's bring you into this Parkinson universe.
So we're getting close to the end. The navigating part is the last thing. And I know you've sort of touched on some of those things already, but I'm wondering if there are some key things that you would like to recommend to people to improve their symptom management or quality of life just in general.
Yeah, so getting back to Bill and some of the other questions here, I'm trying to
There's so many great ones.
and you guys are just awesome. So 151 of you are staying in the box here. Love it. So a couple of things. One, if you're on dopamine, please make sure you're taking a multivitamin because something like a Centrum or Centrum equivalent, you can go to the store, you can look at the what's in a Centrum, get that. You don't need all of these crazy vitamin supplements, but you do need one multivitamin because it depletes the cofactors. Okay. If you have Parkinson, you need to be seeing a dermatologist at least once a year, twice the risk of skin cancer. Okay. So lather up, SPF 50 or better, wear hats and things, protect your skin. Okay. Super important. Twice the risk of osteoporosis, even in men, and Parkinson is a predominantly male diagnosis. And so really important every other year, even if you're a man, to be checking in on your bone scans. It's completely treatable. Certainly want your bones to be stronger in case you fall or trip or something like that. So really important. We like you a little overweight rather than a little underweight, okay? Because you'll tend to lose weight slowly over time. And the most data that we have now is in the Mediterranean diet, okay? But that's not the only diet. And so talk to your healthcare team and see what's right for you. If you get on some of these crazy diets and you do all these things, you may just be making yourself miserable with Parkinson instead of living with Parkinson. And so that's super important. Sleep is so important. Think about getting sensors, watches, rings, Whoop bands, straps, Apple things. If you can increase the number of hours that you sleep a night, your Parkinson is going to be better the next day. And remember that anxiety, depression, and these things can be presenting symptoms of Parkinson and can be very disabling. And a lot of your docs and your healthcare professionals, they're looking at the symptoms that they think are important, the ones that they can see, but it's all these invisible symptoms that are actually causing and driving much of the disability. And so making sure to keep your team together and honest and that they're treating you as a whole person and that Parkinson is a whole body disease. So those are some of the things that we want to make sure we don't leave the cast, the podcast and Zoom today without talking some about some of the practical things that folks can do.
I really appreciate that. And, obviously everyone would love to be able to have access to a movement disorder specialist, such as yourselves. And, we know that there's not enough. And one of the comments or questions was the number of people with Parkinson's is increasing, the number of movement disorder specialists is not. What is that impact going to be like?
Yeah, go ahead, Ray.
Well, I just don't think we're ever going to get enough. The first response to any emergency is to contain it. If a fire is burning in a building, you need to make sure that neighboring buildings don't get it. And we aren't containing the rise of Parkinson's disease. We're using paraquat in increasing amounts. We did ban TC and PC. It looks like that ban's going to hold. But there are thousands of contaminated sites. One of my coworkers today was in my office today concerned about the contaminated site near where she lives in Brooklyn, New York. I got an email from somebody concerned about contaminated site in Indiana and the effects on autism in that community. We need to contain this and mitigate the risk so that future generations are spared this terrible disease. And then Michael outlines in chapter 7, I think, a new care model for Parkinson's that we need to implement. But we need to start paying attention, preventing our kids and grandkids from getting it. You know, we have I think, a responsibility to do so, and I think we quite frankly have a duty to do so. And we haven't fulfilled that duty. We need to make sure that this disease dies in our generation and that future generations are spared the indignity and the terrible effects of the disease.
Well, I want to thank the two of you for sharing your hour, talking to us about your book. Reminder to everyone on here that 20 of you are going to be randomly chosen from today's program to receive a book. And so we will contact you directly and notify you and have that sent directly to your home. I also want to point out, as Dr. Okun has been answering your questions so rapidly, and also references a lot of studies that he reads. If you're not following him on Facebook, I highly recommend that you do so, because he posts numerous times a day, lots of great information. I don't know where he gets all the time to do all of the things that he does, or either Ray or Dr. Okun. Like, they're both extraordinarily busy, yet they do so many wonderful things. So follow him, follow Ray if he's on there. Get their book if you're not one of the lucky 20. You might want to save your chat, because there was a lot of resources dropped in there, a lot of great answers to questions that was answered by Dr. Okun as we were going, because we didn't get to every one of your questions. And you can save that by clicking on the 3 little dots, and there should be a little save chat that's in your chat box. And then, of course, I want to thank Dr. Okun and Ray, Dr. Dorsey, for joining us today, for sharing their expertise, and thank you for taking the time to write these books.
Yeah, of course. And we're on every channel, not just Facebook. And we don't do politics. So if you're looking for us, you know, like we don't do political talk. We just talk about science and helping people and impacting lives, and all the proceeds go to charity. So let's get the word out, and let's all get out and join the PD Avengers, buy a book, and you know, and keep going to these things and help people. It's a community disease. Let's all help each other.
And if we didn't answer your question and it's not answered in the book, we talk about sugar in the book. You can email us at info@pdplan.org, info@pdplan.org. Michael and I actually read every message that comes through so far. And then if you're in DC, or we're going to be there August 27th at the Politics and Prose bookstore. We have a moderator who's a journalist who's a former editor at Politico. C-SPAN is televising it. Invite your representatives, staff from your representatives or senators in DC, invite environmental advocates, invite people from many of the Parkinson's organizations to attend. The more people, if you want to make your voices heard, this is a chance to do it in DC. We haven't had congressional hearings on Parkinson's disease, I think, in 20 or 30 years. This is a chance to make our voices heard. The Politics and Prose bookstore, August 27th, 7 p.m. It's free. All are invited. No registrations required. It's accessible site. We want to have at least 400 people there. So please spread the word, and the link is in the chat. And Michael and I will be there, and so we'll sign copies of the book. And if we didn't answer your questions today, we'll answer them then.
Fantastic.
Yeah, keep inspiring us.
Well, we have a tradition, because we can't clap. You can't hear everybody clap. We're going to give you the wave of gratitude from all 150 plus who was on here today. We thank you so much for your time, to both of you. Appreciate you.
Thanks. Thanks everybody for hanging in there.
And thanks for joining. And if you're a lucky 20, we'll get in touch with you. Take care.